But just keep that in mind. Just know that if you're doing lots of activities and every now and then you don't do as well on the test as you want, that's okay. It's not the end of the world. I certainly didn't have a perfect GPA. I had a good GPA, but I had a ton of other things that I was busy doing. And I think that is what they were also looking at when I interviewed. All right. On to the more fun stuff. I know. I feel like that's important. All that stuff's important to cover, but I feel like people are like, oh, what's dental school like? It's the worst. I'm just kidding. You couldn't pay me to do it again, but it was great while I was there. So during dental school, I was at Tufts in Boston, and it's one of the bigger schools in the country. It has, when we first started, we had 210 people, I want to say, and you lose a couple along the way. Some people, drop out for one reason or another. They don't like it. They realize they definitely don't want to be a dentist. Some people, academically are having a little bit of trouble. I will say that I did not know one person who didn't get all the way to graduation if they worked hard. And that was it. Didn't have to be the smartest person in the room, just had to work really hard. And they made it to graduation. So you'll all do great. I think getting in is the hardest part. So get involved in dental school early with clubs and research and activities. I know that when I was going, I was really intimidated by everybody who was already in, and I was like, the upperclassmen are really scary, and I don't want to sign up for clubs with them. And everybody's just really excited to meet new people and to, have new people around, because you spend so much time with your own classmates that some of your closest friends will end up being people in other classes. One of my closest friends in dental school was actually the year behind me, and it was great. So study with people, studying alone is okay, but I don't know anyone that studied alone all the time. I think that was not something that really happened that much. So there's different ways to do well in dental school. You can do well academically. You can do well clinically. I was definitely better clinically. Even if you're one of the smartest people in your undergrad program, it doesn't mean that you're going to be the smartest in dental school, and that's totally fine. I know that I've got one of my best friends is in medical school, and that's something that I think is dealt with a lot in professional schools, where it's really competitive to get in, and all of a sudden everybody is like busting their butt. And if you feel like you're not doing as well as you're used to doing, it can be kind of jarring, but it doesn't mean that you're not super qualified and doing well. It just means that, you might have other strengths than the person who's getting 100 on every test does. I would say that you spend at least 85% of your day at school, between studying and you're there early in the morning, and then maybe you take a nap there. And at Tufts, the gym was at school, so we'd go to the gym in the middle of library study breaks. So I would recommend living close to school. I know sometimes financially it's a little bit more tricky, but if you're living with people, it was pretty doable. Healthy living environment, that's really important. I got lucky and lived with my roommate for all 4 years, and she was wonderful. I think that having a very, easy roommate situation is ideal, and it's someone that you can study with sometimes, but also just, you don't have to stress when you go home at the end of the day. It can be really nice. All right, so the next slide, why I chose general dentistry. I really do. I liked all the procedures. As I'm reading this, I'm like, yeah, I did. So I do. I liked all of it. There's no pressure if you decide that you want to specialize later. The other thing that sometimes people do is they apply to a program and they don't get in, and then they work for a couple of years, get more experience, and reapply. And that's totally fine too. I think that everyone is just genuinely happy for people that they've found their calling. It's no reason to be embarrassed by anything like that. Most general dentists can work only 4 days a week. Some work a lot less than that. I know some that work 3 days a week. You can be your own boss. You can own your own practice, or you don't have to. You can work for other people and never own your own practice, or you can own 5 practices and never practice dentistry. And there's so many ways to do it. There's some dentists that go and get their MBA and then just own dental offices and hire other dentists to work in them. And that's definitely a thing. Flexible schedules, that goes back to how many days a week you want to work and also what your hours are. So right now I'm working kind of like 5.5 days a week. I sometimes work Saturdays, and it's because I'm new and I'm enjoying it, and I like being busy, and there's a pandemic, so what was I doing on Saturdays anyways? Really nothing. So you can kind of make your own schedule. It's really enjoyable. Getting to know patients over time. Yeah, so I think that this is one of the biggest perks of being a general dentist, probably also a pediatric dentist, though. You see people really regularly. So you get to know them, all of a sudden you get to know their spouse, and then their kids come in, and then, they're sending their neighbor to you or their coworker to you. And you really get to know people super well. And it's a really, I don't know, it's a very like intimate relationship that you develop with patients, I find, because this is my philosophy, at least when I'm working with people. I like to ask them about themselves, and if you think about it, their head is in your lap for however long. Sometimes the appointment's an hour and a half, and I want them to be really comfortable. So we have a really good time, and we're talking the whole time. And these days we're playing this game. Okay, I'll share this. So these days, one of my assistants and I play this game where we ask them their preference on things, and then they have all this stuff in their mouth, so they can't talk, but we'll have them hold up their fingers for like what their opinion is. So it's like, who do you think's the better singer? John Mayer, I don't know, Jack John, like we'll choose people that are similar. Or like, who do you think is the best actor? Jack Black, like The Rock, I don't know, like the craziest stuff. And the most frequent one we've been asking people these days is, which one do you think is real? Witches, ghosts, or aliens? And their responses are so funny. So, I don't know, we just have a really good time with people, and getting to know people is really fun. And I don't know that that's something some of you might be rolling your eyes and thinking, I don't want to do that all day. And that's totally fine. You will still be a great dentist, but just know that, that's also an option. You don't have to be. Some people probably want to go to the dentist and not talk, but most of my patients don't. Most of them, they get in there and they're like, all right, what do you got? What's new for me? So other specialties, if you're an endodontist and you're doing root canals, there's a rubber dam, this like latex sheet in this patient's mouth for the whole time, so the patient can't talk at all. If you're an oral surgeon, maybe the person's sedated the whole time and they're not talking at all. Gum surgery, the person's not talking, they're bleeding all over the place. Ortho, usually an assistant is like changing brackets or wires or something, so like that's not necessarily the chattiest time, or it's not with the orthodontist, maybe, I don't know. So I think it's a perk of my job personally, but totally up to you if you want to be a chatty dentist or not. So I guess I'm not chatty if I'm just having them hold up their fingers. I'm chatty, they can't be chatty. That's the difference. So next slide, GPR. Okay, so this is something interesting, I think. I feel very adamantly about this, and I've talked to my dad about it too, and I think that he probably feels similarly, but I think that it used to be a perk of dentistry that you didn't have to do a residency. So for those of you that are like, what are you talking about? When you go to medical school, it's required that you do a residency after, right? It's, the big thing, match day, and you go back and do more training for, I don't know, I'm going to get it wrong, 3 to 6 years, 12 years, depending on what specialty you choose when you're in medical school. And while that's sometimes true for dentists, it wasn't always true. So for dentists, you could go straight into practice and never do a residency. And for schools that have a really good clinical education, and they're sending you out of school saying, oh, you're going to do 100 extractions, you're going to do 100 fillings in dental school, you can do all these things. That was something that people felt really secure with. And they felt like, oh, I am going to be ready when I get out of dental school to start working immediately. And I think that that's shifted a lot. So I'm going to encourage all of you to go into dental school assuming you're going to do a residency. Even if you want to be a general dentist, doing a residency is so much more experience, and you will get a better job coming out of residency because of it. You might get paid a little bit more. You'll be faster, which, if you're on a pay scale where you're getting paid for like how much you're doing during the day, that will have an effect. It's just a really good experience. You'll be more confident in your own abilities. So, and you still get paid for it. But if you're a general dentist, I think it's a big thing. And as the classes in dental schools are getting bigger, because it's kind of happening across the board, there is less work to go around anyways. And so it's a good thing to do. Anyways, that's all I'll say about that. I did a residency. I thought it was super worth it. It kicked my butt, but it was amazing. I was in Northwestern in Chicago. And for mine in particular, when you do a general practice residency, there's two different ones for, I can do it. It's been a long day. There's two different types of residencies for general dentists. A general practice residency, which is the one I did, and an AEGD, which is an advanced education in general dentistry. So mine I chose because this type of residency is hospital-based. And so there's a couple things that are requirements for it. You will have on-call hours in the hospital. This depends on the number of on-call hours, depends on how many residents there are in your program. For me, it was just me and one other girl. And so we were on call every other 24 hours and every other weekend for the whole year, which was literally the worst. I still have PTSD from my pager going off at 3 a.m. I swear to you, sometimes I'm in like a public place and someone's hospital pager goes off and I feel my soul leave my body. I cannot explain it. I swear it gives you a cold sweat. It's the worst thing. So even though it's the worst, it's the best too, okay? And here's why. You will learn more at 3 a.m. when no one's answering their phone and you have no idea what you're doing than any other time of the day. It is totally like you have to figure it out. And that's great. Someone's going to come in and it's going to be something wild. You have no idea. I got to the point, I loved it. It was so fun. I have pictures of stuff, so I won't spoil it too much, but stuff would come in that was crazy. And if they called me for something that wasn't crazy at 3 a.m, that's when I was mad. I was like, you woke me up for this. And the people are really nice that are awake at 3 a.m. that work in the hospital anyways. And so they were always like, oh, we're sorry. But if it wasn't gross and disgusting or like really cool, I didn't want to see it. So it was a good experience. You do rotations also. So I did an oral surgery rotation, a radiation oncology rotation, anesthesiology, and emergency department. You do a lot of emergency stuff. You usually get them at like bad times, but sometimes you get them during the day too, and then you can sprint down. I worked with patients whose work was all subsidized by donations, which was great. So in real life, and by real life, I mean like in private clinics, residency to me feels like not real life, which is like a funny situation. But in like an office, when you're applying to insurance and things aren't being paid for through a grant, the charge for a root canal could be like $1,500. Okay. In my residency, this is cool, root canals were $50. So you better believe that instead of saying, I want this tooth pulled, so-and-so was like, yeah, root canal it. Let's see if this works. So you get to do a lot of work because that's amazing. Like what a great opportunity for you to change someone's life by letting them keep a tooth that they wouldn't otherwise be able to keep. I mean, the joy is amazing. And I'm ecstatic because I'm like, I get to do a root canal. So it was a great experience. I really enjoyed it. So, and I touched at the bottom on GPR versus AEGD. Okay, so I know I blab a lot. So here's some examples. I'm so sorry if you've already watched me talk before. These examples are the same. I fully meant to change them because I know I'm repeating myself. They're great examples, but, spice it up a little bit. Okay. So residency example 1. I took all of these photos, by the way. So this is like, it's kind of cool. Anyways, this guy, classic, it's 3 a.m. and this awful sound goes off and you're risen from the dead by your pager, and you went to sleep at 11:30 anyways because you were worried about your pager going off, and so you couldn't fall asleep in the first place. Anyways, so your pager goes off. The nice person at the emergency department that you call says that they have a 45-year-old male who has this really large lump on his cheek and says he's had tooth pain for a long time. And so they're calling you because they're like, we don't know what this is. Can you come in and take a look? So especially with the large lump, you'd probably request a CBCT, which is a type of CT x-ray, and see where this lump is originating from, okay? And so a CBCT is 3 dimensions, which is really great. You can see, everywhere in the jaw area, and in this case, because the abscess, this is an abscess. Okay, sorry, I have been up for a while today, so I'm jumping around. This is not... Basically, what this ended up being, this is presenting like a big pimple, but this is a tooth abscess. And I'll try to make a visual for you. I wish I had a piece of paper. I don't have any paper. Okay, visualize this. You've got a tooth. Here's your tooth, okay? And the infection gets into the top of the tooth, okay? And you've got the root of the tooth down here, all right? And it works its way down into the tooth where there's that nerve and the blood supply of the tooth, and it doesn't have anywhere to go, so it creates this like pocket at the end of the root of the tooth where it's like an abscess, it's an infection, okay? And it eats away at the bone because it's infected, okay? So it keeps getting bigger because this person is like la-di-da, he doesn't feel any pain anyways at that point because the tooth is dead, the nerve is dead, so it's sneaky. Infections don't always hurt, okay, in this situation. So it just keeps getting bigger, and all of a sudden it starts working its way through the bone, okay? It makes its way all the way through his jaw, like the top of his bone. Up here, it's not his jawbone, it's the top tooth. And all of a sudden it hits his cheek, like here, and it starts to collect. And that's when he's like, this hurts. But he doesn't know what it is. And eventually... it really hurts. And you know what it really hurts from usually is just the pressure that's built up from it. So generally speaking, when we go in at 3 a.m. to do these, they haven't presented like this on the cheek. They are really swollen and their eye might be swollen shut and they look like, ginormous. But usually we see it from the inside of the mouth. And those ones, the general dentistry residents would take care of. And you make an incision, and it explodes everywhere, and you suck it up, and the patient's in there with their significant other, and the other person is like, up against the side of the room. It's awful. It's amazing. Instant relief. They feel so much better. This guy, because it presented like a pimple on the side of the cheek, was oral surgery. So my friend, who was the oral surgery resident, came in and helped us out with this. And it leaves a scar because of how it ends up healing usually from this, but not too bad. This guy was ecstatic 24 hours later when I saw him. So, true story. I hope I made that exciting enough for all of you. Okay, next slide. We'll do residency example number 2. This is a really interesting case. So what you're looking at to orient everybody a little bit is you're looking at the back of someone's mouth, and you can see those teeth on the bottom, right? And then behind that, you see that almost like cauliflower-ish, yellow and red, like it looks like little, like, I don't know what's a cauliflower kind of, right? I guess that's a good explanation. You can see it, right? People can see this. So this is oral cancer. And we were consulted by oncology because the patient is about to have head and neck radiation, okay? And they want to know which teeth need to be extracted because of the radiation that they're going to receive. So let me explain. So what happens in this case, okay, is that when you receive radiation due to cancer treatment, one of the biggest effects after the radiation is that the blood supply in that area shrinks. Okay, and what that means is that area, because it has less blood supply, will no longer heal well afterwards. So this person is going to have a bunch of radiation to this area of their mouth, right? So a lot of things happen when you have head and neck radiation, okay? The muscles all tighten, so sometimes people can no longer open their mouths. I've seen people who only have this much opening after getting head and neck radiation. So how do you fix a tooth if it gets a cavity? The person can't even brush their teeth, right? So what happens in the hospital is that there's a lot of this management beforehand where we say, you're going to get this dosage of radiation. These are the structures it's going to hit. This is what we need to do with your teeth before. And it usually involves taking out a lot of teeth. So for this person, you can see how it continued actually. You can see it mostly on that side, that right side behind his tongue, but it continued under those teeth as well. But I don't remember exactly which teeth we took out. But I will say that we had a lot of patients. I met some of my favorite patients this way who were coming in for cancer treatment, and I took out every tooth in their mouth before they were allowed to get their cancer treatment. And that's to prevent infection for them. We did the same thing for cardiac patients who were having valves replaced, people who were going to be on bisphosphonate medications for certain cancers. There's a lot of different reasons this happens, but talk about a bond that you create. When you take out every single tooth in a person's mouth before they start chemo, that is intense, and it is really devastating. You know, they feel very like, vulnerable, obviously, and very, they're already going to go through something so difficult. And in the process, we're going to take out all of their teeth. And everyone understands that it's because, a lot of the people who we're doing this for never took care of their teeth up to this point. So they all have, infections in them already. We're not taking out perfectly healthy teeth. We're taking out teeth that have issues. And then we make them dentures after. But through this process, you become really close with people. Like, I get people's Christmas cards who I've met this way. So it's very, it was a really cool experience and very interesting. But this person, I don't remember exactly what happened with them, but that's what this would have been for. I just thought that this picture was crazy. So, all right, next example. All right, let's orient ourselves to this photo. So this person, this is them with their nose is up above the edge of the screen. And so that is that arch is the top arch of their mouth, and they're missing all their teeth up there. They've got only those teeth. It's the left side of the screen, that's the right side of their mouth, right? And that's their tongue at the bottom. So the hospitalist, which is like a primary care, or like a internal medicine person inside the hospital, consult us because they think that the patient's cancer has returned because they've stopped eating. But it turns out that they didn't realize that this person had a denture in. And this was actually a fungal infection. This is an oral yeast infection that's called candidiasis. And this happens a lot for people who, number one, are immune suppressed. Number two, dentures is a huge risk factor for this. And people who have dry mouth. So if you're older and you've been on lots of medications, that causes it. But when I walked into this patient's room, I immediately knew what it was because it smells like, like really like strong, like beer, yeasty smell. Or did any of you guys make like lots of bread during the pandemic a year ago? No, just me? Okay. Well, it smelled exactly like that. And that's a very classic sign for like a very bad infection like this. It burns, it's very uncomfortable for them, but it's fairly easy to fix with some medications. So that was good. And I don't know what ended up happening with this after. Okay, working now. The next slide. That's yours truly with our office dog, who is a nutcase. And I feel like if you were to go back and find all the other times I've given these presentations and I talk about this dog, I probably at the beginning At the first presentation I did, I was probably like, we have an office dog, it's amazing. And now I'm like, we have an office dog and I want to murder her. So she's wonderful. She barks a lot. Today, she was just going after the squirrels in the backyard. And I was like, I am going to literally annihilate you. So she is so cute, and she gives all of us more therapy, I think, than patients, because it's really wonderful when you're exhausted and you spend 10 hours a day talking to people about God knows what. And you really are a therapist while being a dentist at the same time. Like, it is just, they go hand in hand. People sit down in your chair and they're like, oh my God, let me tell you what happened to me this week. And I'm like, okay, we don't really have time for this, but sure, make it brief. So after a few of those, sometimes you just need a dog to hug you, you know? So that's what we're doing. What I'm doing now a lot, I do a lot of patient exams, of course, a lot of fillings, of course, crowns and bridges, veneers, removable, so some dentures. I do those less now than I did. I did a ton in residency, but the people that I work with now, the patient population is pretty young. I'd say the average age is 24 to 35. So most of those people have all of their teeth. There's people who might need an implant because they're missing one single tooth, but you're not doing you might do a flipper if they play, I'm in Boston, if they play ice hockey and they keep knocking their tooth out, you might do like a little removable thing, but like most people at this point are, Botox and fillers. Oh, I skipped Invisalign. I'll come back to that. Botox and fillers, I don't personally do, but I know it's becoming bigger with dentists. One of the dentists that I work with, two of the dentists that I work with do it. I wouldn't say it's like the most popular thing. I'm struggling personally, if you want to know what I'm struggling with it, to decide if I think that it's something that I would get a lot of patients from. And I think it happens more when you have a dental office that also has a med spa aspect, which is pretty popular. So I like it. I think that I'd really enjoy doing it. I just am really busy right now with other stuff, and I don't know if I really have the space to put it in my schedule in a way that would like be enough that I think it's worth it. It's like, I think like $3,000 to get certified, so it's like a commitment to do it. You know what I mean? Anyways, enough of my soapbox. Okay, maybe I don't know. So Invisalign, I do a lot of Invisalign. The other dentist that I work with, she is a couple years ahead of me. She graduated from Tufts actually a couple years before me. She does a lot of Invisalign, like a lot, which is cool because I get to ask her if I ever have any questions about it. But if you're going to be a general dentist, just do it. Like, what are you waiting for? Everybody is asking about it. They really like it. Emergencies and extractions and endo. So I love doing root canals. I still love doing extractions. It's really fun because I get to send things now to specialists when I don't want to do them, which is really nice. I'm like, not for me, have fun. This sounds like something I don't want to do. All right, so let's do a couple examples of things that I've worked on in the past. This is where I really wanted to put in some new examples, and I have some stuff in the works, so like maybe if I do this again a year from now, I'll have more photos to update things with, but it really takes a while. And just so you know, these are like photos that were taken on my iPhone, so if they're questionable quality, that's why I don't want to hear it. So dentures. So dentures are wonderful. It's a really cost-effective way to change someone's life, if that makes sense. So instead of doing an implant for every tooth, which doesn't make sense, like this top one, for instance, is just a conventional denture. He had really bad periodontal disease, gum disease. The bottom one is a denture that fit into implants. And both of these patients were ecstatic. Let me see. The next slide, these are crowns. So I like the picture on the far left because I like that you can't tell which the crown is. I think that's wonderful. I don't think that people should necessarily know that they've had work done. My biggest pet peeve is when someone has a crown, it's like they've got beautiful teeth and they've got this one that looks so wonky, and I'm like, ugh, no, not a wonky, like, it's just easily avoidable. There's just really nice materials out there. So I avoid the wonky ones. So I like when they match nicely. The one in the middle, she was ecstatic. That it looked beautiful. That little black triangle in the middle will fill in. That was just taking the data we inserted it, and your gums sometimes have to fill in the space. And then the one on the right is one of my favorite patients from residency, and that was kind of in progress. That was when I left, so it wasn't totally done, and the bottoms weren't done, but you can tell there was a huge difference there. They look great. So, anyways, that was very fun. And my next one, this was a girl who came in as an emergency one day in my office, and this was only a couple months ago, and was like, oh my God, my tooth, I've got an important meeting tomorrow. Of course, because things don't happen when you have a week to plan for them. It's always like, someone told me I'm getting engaged tonight and this tooth fell out. Like, it's something crazy every time. So that was like this girl, she had something really important, and we just did this in the office. We were like, let's fix you up. And so when people say that dentistry is like arts and crafts, this is absolutely what they mean. It is like arts and crafts. And it's not something that you just like know how to do when you get to dental school. Some people might, but they have you practice a lot of this stuff. So don't feel like you're like, oh my God, how do you make a tooth out of nothing? You will learn. They will teach you. You'll carve it out of soap. And then this next slide. So the next two slides, the next slide though, so this is Yuki Moma, I don't know how to say his name, Mama, is a ceramicist. So ceramicists are people that make teeth out of porcelain, so crowns, bridges, fake teeth. And I added this because I think that one of the most important things is to have people that look up to you, have other people that look up to you, have people that you look up to. And I think his work is amazing. And I like to find people that I try to emulate how skilled I think that they are. And this is, I think, a really good example of that. And so dentists will send him things and he'll send the crown back. So he's not like putting things directly into someone's mouth, but he's so talented. And I really like how realistic it is, obviously, because, we talked about the wonky thing. And then the next one, so this guy, I don't want to say his name wrong, but I think it's Dr. Rodri Thomas. And he is, I think, from Wales, but he does really beautiful work as well. And it's he does a lot of free-handed stuff as a dentist, which is very cool. And Cosmodent is a company that is based in Chicago, and they do composite materials and things like that. But they also do a lot of courses on how to freehand dental work like this, like dental aesthetics. So, and those are free. Some of them are free online on their website. So if you were ever someone that was like, oh, what am I talking about? I mean, you could always check it out. But I think that it's a really very fun aspect of dentistry, and he's really talented at it. So these are people that I follow that I just, I'm always like, ooh, what do they do now? I'm like, great, I want to do that too. So anyways, that's my spiel. Of course, if anybody has any questions ever, please feel free to message me. I do respond to all of them. If you have questions about what I talked about today, if you want, advice on something, I'm so happy to help. I feel like I had a lot of help along the way. I was really lucky that my dad was a dentist, so I had someone to ask questions to. And if you feel like you don't have anyone to ask questions to, I'm happy to try my best to either help you or, point you at least in a direction that might be more helpful. So anyways, thank you so much.
Thank you so much, Dr. Rosen, for this wonderful presentation. It was really informative. And if you don't mind, we have a few questions in the chat.
Let's do it.
Okay, so as you know, it is application season, and everyone is like most seniors are applying, and obviously they're overwhelmed with taking the DAT and applying. Some are like doing both.
Yeah.
And most questions in the chat seem to be like, what do you recommend to study, to use to study for the DAT, and what do you recommend when applying? Any DAT tips?
Yeah.
Okay, go ahead.
I studied for the DAT during my victory lap year. I took those two classes, and I took, I want to say, 3 months to study for the DAT. And I treated it like I lived at home with my parents and I treated it like a 9 to 5 job. And I went to the University of Delaware Library from 9 a.m. till like I took a break in the middle of the day, but I was like pretty regimented about it. At least this is what I remember. Okay. If this sounds crazy, I probably goofed off a little bit too, but I remember being wildly unhappy. So probably didn't goof off that much. Um, I studied a lot for it and it paid off. I did really well on it, but I want to say and don't, there might be better things out there. I mean, keep in mind that this was in 2014. So this was a while ago. Not that long ago. I'm not that old, but you know what I mean? So I, I think I studied with the Kaplan book, I want to say, and I think that they had some online practice tests, but I remember running out of things to do, and then I might have gotten Crack the Dat. Does that sound right?
Yeah,
That's the thing?
that's one of the programs, yeah.
Yeah, I think that you could just do something too where you just like bought like Crack the Dat practice exams. Practice exams are super helpful. Like make sure you're going through obviously all the other stuff, but don't undercount like practice exams. And then when you do an exam, take the questions that you got wrong and make sure you're going over those. You know, that's what I remember doing. There might be things that are better out there though now than when I was studying for it. So maybe look on like Student Doctor Network or something and see if like people are saying like that they've had recent success with certain things if you feel really lost. Otherwise, I'm sure that, Kaplan's pretty predictable. I feel like that's like a good place to start if you have no idea where to start.
Thank you, Dr. Rosen, for your response. Another question is, when should I apply for dental school if I still have 1 year to complete my bachelor's?
Well, if you still have one more year left, I guess so. The application cycle is like nowish,
Yeah.
right? I won't remember. This
Yeah.
is not, I don't know if I'll be that helpful with this question. I think it's up to you. I think that there's perks of doing it right when you're done school, right? And just going straight into dental school. And there's perks of taking time off if you decide that you want to do that. And that's up to you. When I worked in my gap year, I was able to save money because I was living at home with my parents, and I used that as spending money for all of dental school. And whenever I needed a weekend break or I went on a trip to visit people, I felt like I had this like little reserve that I could kind of dig into, which was nice. So when you apply is up to you, but there's lots of perks to doing it right away or waiting. So you're just gonna have to kind of, I think, figure out what you prefer.
Okay, thank you for your response. Another question is, did you ever use Anki flashcards to study for the DAT?
Anki flashcards?
Yeah.
I'm gonna Google this. How do you spell that? O-N?
No, it's ANKI.
Oh, I definitely didn't then.
Yeah, I think it's a new thing. Like it's like Quizlet with like how you create flashcards, but I guess you have like more labels into like how confident you are with um like the flashcard that you made.
So, okay, here's the thing. I understand, and I totally get why there's lots of questions about how to study for things, but everybody studies so differently. There are people who have to write down every single line of something in highlighter in different colors to know what it is. Some people can type things out. Some people throughout dental school used only Quizlet and made like flashcards. I wrote out a lot of flashcards by hand. Anki sounds great, but only if it's going to work really well for you. And if you sound like a really smart person, if you're already at this point, I trust you. You're doing great. You're going to do amazing, but just make sure that and you can always like, if you're trying Anki or you're trying something and it's not working, try something else. But, only you're going to know how you're retaining information, because everybody learns so differently. So that's Anki. I love Quizlet. So if Anki is kind of like that sounds great to me, but like, I don't know if that's good for you.
Yeah, I think everyone has their own manner of studying, so whichever you like the way you've been studying.
I cannot tell you how to study.
Yeah, it's the
I mean, I
same
can
way.
tell you I ran around a house opera singing sonics to myself. And what I tell, I mean, that's true. I sometimes had people sing me things and I sang it to them because that just helped me remember it, because I was like, this is absurd. I'm never going to forget this. And I didn't, but
Yeah,
you can't do that for the whole DAT. So I can't recommend that. Sorry.
Yeah. Let's see here. How is your undergrad different than dental school? And if you don't mind sharing, what kind of GPA and DAT did you have?
Yeah, so undergrad and dental school were very different. Um, I would say the biggest thing in undergrad was I went to a school that was probably considered a party school, University of Delaware. I think like those of you who like care, I don't know about this. I think Barstool even or like something came out a couple years ago saying it was like the #1 party school in the country, and it was like a big deal. All the alumni were like, "Oh no, this is so embarrassing," and I'm sure all the people there were like, "This is amazing." So I felt like personally I was studying a lot there while everybody else was having a really good time, and that's okay. I was totally fine with that, and it paid off. Like I don't regret it, but I felt like when I got to dental school, all of a sudden everybody was studying, and that was really nice. It felt like we were all a little bit more on the same page. For those of you that feel like you're probably in the same position, because I think that's a lot of people who are trying to like get into grad programs, that's I think one of the biggest perks of grad school is that once you get there, everyone's like, oh, we have all the same interests, we all think teeth are cool, amazing. Like so that's a big perk. University of Delaware was really not rural, but it was like in the suburbs-ish. It was like in a college town. And Tufts is in the middle of Boston, like in the middle of Boston. It's in Chinatown. It's really very metropolitan. It sits on top of a T-stop that's connected to a huge medical center. So like there's a million things going on all the time. And that was a big difference. What else? Wait, what was the second part of that question?
It said what kind
what
of
was the
GPA
GPA and DAT
Yeah.
and DAT scores like? Okay, let me see. So I think I was like a 3.5 GPA in undergrad, I want to say, ish. And I want to say that I was like, I did really, so wait, what are the sections of the DAT? I did really well in the perceptive one, where there's like the triangles and things and the angles.
There's biology, there's chemistry, organic, reading, and math.
Math, I did the worst on math. Math has never been my thing. I want to say I got like a 32 on...
It's out of 30.
Yeah, see, I wouldn't remember. Then I have no idea. Maybe I did really well on perceptive reasoning or perceptive chemistries and the reading one. And I think the other ones were like, like math was like, math's not my thing. I can count to 32 teeth, that's it. So it's fine. And I know some people who took it multiple times. I know people who applied to dental school like 5 times and got in and are great dentists.
Oh, wow.
So you're good.
So to wrap this up, to everyone that's applying, what is like some things that you would recommend to have like on your application for sure, or some things that make you a better applicant? What are things like to make you apply this year or wait another year? Like, what do you recommend, since applying to dental school can be expensive and it's very overwhelming?
Very expensive. Don't apply without having lots of volunteer hours in a medical environment. If all of your shadowing hours are with a family member, don't. Get shadowing hours with people who are not family members, because it shows more outreach. If that family member has a different last name than you can probably get away with it. I would say No, I think those are the two big ones. Um, I don't know. It's very different. Everyone's resume is going to look so different. But I think that the big ones are showing that that can be shown in so many different ways. But I would say just know that when you're looking at your resume, you're like, oh yeah, this shows that I'm specifically interested in becoming a dentist. You know,
Yeah.
that's really important. I think that that's something that we looked for a lot during interviews.
Okay.
But
And do you think research is crucial? And if the DAT is not like as high, if it's average, do you
I
think
don't know what the
that
rest of your resume looks like.
right?
I don't know. And even if I saw it, it totally depends on who looks at it in an admissions office.
Right.
You know, I did have some research on mine. Was it big research? No. I like typed in numbers for somebody doing something ridiculous. But if you're worried about it and you have this summer and you feel like you have some extra time, I would who could you reach out to if you were wondering about getting research hours? You could reach out to like local schools or local like biology departments at your university and just say like, is there anything that you could like have me participate in just to like, I don't know. That's a really good question, but I think it just depends on like the kind of the overall package and also like what they're looking for. But I don't know that I'd say research is crucial.
Okay. Well, let's wrap up this session. I'd like to thank you so much for your time, Dr. Rosen. You've been a great help, and thank you for preparing this wonderful presentation. If you guys have any questions, be sure to reach out to Dr. Rosen and follow her on her Instagram.
Oh God.
And I will be posting the post quiz session in our group meet chat, so be on the lookout for that in a few minutes.
Thank you so much.